Hi, I'm Aaron Aldifer, and I'm presenting on low back pain. Low back pain includes pain in the lumbosacral area caused by a variety of musculoskeletal dysfunctions, which are often, unfortunately, unidentified. There are many common possible causes of low back pain. Some include sprains and strains, or herniated or ruptured discs. I will elaborate on those two causes later on. Intervertebral disc degeneration is one of the most common mechanical causes of low back pain, and it occurs when the usually rubbery discs lose integrity as a normal process of aging. In a healthy back, intervertebral discs provide height and allow bending, flexion, and torsion of the lower back. As the discs deteriorate, they lose their cushioning ability, however. Radiculopathy is a condition caused by compression, inflammation, or injury to a spinal nerve root. Pressure on the nerve root results in pain, numbness, or tingling sensation that travels or radiates to other areas of the body that are served by the same nerve. It may occur when spinal stenosis or herniated or ruptured disc compresses the nerve root. Sciatica is actually a form of radiculopathy. It is caused by the compression of the sciatic nerve, which is the large nerve that travels through the buttocks and extends down the back of the leg. This compression causes shock-like or burning pain in the low back, which combines with pain through the buttocks and down one leg. In an extreme case, when the nerve is pinched between the disc and the adjacent bone, the symptoms may include pain combined with numbness and muscle weakness in that leg. Spinal stenosis is another common cause of low back pain. Spinal stenosis is a narrowing of the spinal column that puts pressure on the spinal cord and nerves, and it can cause pain or numbness with walking, and over time leads to leg weakness and sensory loss. Skeletal irregularities include scoliosis, which is a curvature of the spine that does not usually cause pain until middle age. These irregularities also include lordosis, which is an abnormally accentuated arch in the lower back. Other congenital anomalies of the spine are also included in this category. When it comes to what makes up the lower back, the lower back consists of vertebrae, and the spaces between these vertebrae are filled with intervertebral discs. They act as shock absorbers in the spinal column for cushioned movement. Ligaments hold vertebrae in place, and tendons anchor muscles to the spinal column. Most pain occurs in the lumbar region between the lumbar vertebrae L1 and L5. Many structures in the low back contain pain receptors. They could all be possible causes of low back pain, including the anterior and posterior ligaments, interspinous ligament, yellow ligament, posterior annular fibers of the disc, intervertebral joint capsules, vertebral fascia, blood vessel walls, and paravertebral muscles. Low back sprains and strains was the first common cause I had listed. Sprains and strains account for most low back injuries, and they can be caused by lifting something improperly, lifting something too heavy, or overstretching. They are often present in two common types. A muscle strain is when the muscle is either overstretched or torn, resulting in damage to the muscle fibers. This is most likely referred to as a pull muscle. Lumbar sprains are when the ligaments are either stretched or torn. Ligaments are made up of strong connective tissue, and they connect bone to bone, so they connect vertebrae to vertebrae or pelvis to vertebrae. Herniated or ruptured discs are also a very common cause of low back pain. Herniated or ruptured discs can happen when the intervertebral discs become compressed and bulge outward. The bulging is called a herniation. They can also rupture, which will cause the pain. Low back pain from a herniated disc can actually be from two specific problems. The first problem is disc pain. Disc pain is when the actual space itself is the source of the pain. Now, pain can also come from a pinched nerve. Herniation of the disc is pinching or irritating a nerve in this case, which causes localized pain and then may radiate to other parts of the body if not treated correctly. Symptoms of low back pain can vary in intensity, from a constant dull to a sharp and sudden pain, which can then lead to incapacitation over time. Most low back pain is acute. It will only last from a couple of days to a few weeks. Low back pain that lasts from 4 weeks to 12 weeks we call subacute. There is chronic low back pain, which is defined by pain that endures up to 12 weeks or longer even after the cause of acute back pain has been treated. When it comes to diagnosis of low back pain, physicians will use medical history and physical examinations to help identify serious causes of low back pain. Information about onset, site, and severity of pain may be asked, along with symptoms and any limitations of movement that can help find the cause of the pain. Even after a thorough examination, however, the cause of chronic low back pain is often difficult to pinpoint. Some physicians may ask for X-rays, which can help identify broken bones or injured vertebrae. CAT scans may also be used, which helps see problems in the back which cannot be seen on X-rays. These problems include anything from disc ruptures to spinal stenosis or even tumors. If it is deemed necessary, some surgical intervention could be used in order to determine what the pain is coming from also. Low back pain can affect the exercise response. Often, subjects with low back pain will experience weakness in back extensor and abdominal muscles. A brief rest period is advised after acute flare-ups of pain. A graded exercise test is not recommended after a period of pain. The patient may be limited by their pain and not their fitness. The patient should shy away from high-impact exercises that place the body in sustained spine flexion, exercises that load the spine, or maximal testing, because maximal testing and all of those others may provoke the pain. Low back pain can be managed. It can be managed often through heat or cold. The heat and cold can help ease the pain and reduce inflammation, along with allowing greater mobility. Activity and strengthening exercises often help speed the recovery from chronic or subacute low back pain. But one thing that many people do not know is that inactivity tends to worsen low back pain. Over-the-counter and prescription medication can help treat pain, but it cannot help treat the cause. These medications include analgesic medications, anti-inflammatories, and topical medications that are spread on the area of pain itself. Also, physical therapy can help strengthen core muscles, improve mobility, flexibility, and posture, which all in turn help out with the low back pain. My case study is a 25-year-old male with low back pain that was identified as a muscle strain. There are no known symptoms for cardiovascular disease, so due to the lack of symptoms and his age, he is a low-risk patient. His goals are to decrease and eliminate low back pain if possible. He would like to resume his normal lifting schedule. He'd also like to return to a normal range of motion. One thing to note is that during his rehabilitation, he should discontinue his normal lifting routine, as loading the spine can promote further low back pain and also impede the healing process. One thing that is interesting about low back pain is that the diagnosis itself does not indicate a need for a graded exercise test. The subject is low risk, therefore he does not need a graded exercise test, but an exercise test could be used to obtain a possible cardiovascular training level if they have not had a peak VO2 or VO2 max measured before. The graded exercise test, if performed, should be submaximal, as maximal tests may sometimes worsen pain and cause them to stop due to pain, which would skew test results if they stop before their maximal level of fitness is reached. The type of test used could be a cycle ergometer, an upper body ergometer, or a treadmill, and that can be determined based on the subject's most comfortable position for exercise, as long as it does not cause them any pain. Submaximal testing is suggested for strength tests also. Flexibility tests can be performed normally, measuring range of motion of the spine and identifying any limitations that need to be improved upon later on. When it comes to the actual exercise prescription, I would prescribe cardiovascular training, which involves fast walking at moderate intensity from 40 to 60% of the estimated peak VO2. Walking instead of running is important because walking is low impact compared to running. The subject should start out walking 3 days per week, possibly increasing up to 5 days per week. The subject should start out walking for 15 minutes per session and gradually increase up to 20 and 30 minutes per session at their own discretion, as long as there are no problems. Resistance exercise is recommended. The subject should use machines instead of free weights, which will minimize loading on the spine. Exercises that the patient can include in their routine are seated rows, lat pull-downs, leg press, leg curls, knee extension, and chest press. Also, physio ball ab curls are one thing that will help improve core strength. All the exercise should focus on improving endurance, which would mean repetitions of 12 or more, and at an intensity or weight that allows them to perform 12 or more reps, as long as there is no discomfort. Sessions should be no longer than an hour, and they can be performed 2 to 3 times per week in non-consecutive days. For flexibility, static or PNF stretching is recommended. Most likely the subject will do static stretching because PNF stretching requires a partner. Subject should stretch to the point of slight discomfort or tightness, as long as there is no pain. Each stretching session could last for up to 10 minutes and should be performed 3 days per week. They can progress up to 7 days per week actually over time, as long as there is no discomfort again. The subject should perform each stretch 3 times for 30 seconds, and the stretches can include things like knee to chest, figure 4, hip flexor stretch, towel hamstring stretch, and back flexion stretch. In conclusion, low back pain is a very common issue that most people will experience in their lifetime. If low back pain is experienced, do not stay sedentary for more than 1 day after experiencing the acute pain, or the issue can intensify, because it is natural for many people to remain sedentary after pain. Although low back pain may not be cured in all cases, meaning permanently discontinued, a well-constructed exercise program can significantly improve quality of life and decrease low back pain. A note for future reference: lift with your legs, not with your back when lifting heavy objects. This will help prevent any low back sprains and strains in the future. And generally stay active and stay healthy to keep the doctor away. These are my sources, and thank you for listening.